In this week's Cardiology Countdown, we have interesting papers published on guideline adherence in coronary disease, management of atrial fibrillation, and a novel look at management of patients with heart failure with preserved ejection fraction. So beginning at the number 3 spot is a report from the Get With the Guidelines CAD registry that looked at the trends in guideline adherence over time from 2000 to 2008 in over 100,000 patients, and looked at the vexing issue of the paradoxically lower use of guideline therapies in patients at higher risk, seemingly those who need it the most. What was seen was a steady improvement over the 8-year period, but slightly greater improvement and hence narrowing of the gap in the high-risk patients, so that the hope was that this could be a sign of the end of paradoxical care as patients are managed more in quality hospitals using registries to monitor data. So a sign of hope in guideline adherence. At this week's number 2 spot is an interesting analysis of quality of life from the RACE-2 program that studied patients with atrial fibrillation, comparing a standard or more lenient target for rate control versus a strict target of aiming to get a heart rate less than 80 and less than 110 with exercise. In the trial as a whole, no difference in hard clinical outcomes was seen in this randomized trial of about 600 patients. And this report looked at the quality of life scores that across a broad array of symptoms did not find any difference between the strict and the lenient AFib management strategy. Instead, some of the baseline characteristics were better predictors of the worsening quality of life. And at the number 1 spot is a randomized trial in patients with heart failure with preserved ejection fraction, a very difficult group of patients to manage. This was a randomized study of 64 patients that looked at a supervised exercise program versus usual care. The supervised exercise program used initially twice weekly, then 3 and 4 times a week, aerobic exercise targeted to their oxygen uptake. So very sophisticated, increasing aerobic exercise, and found improvements in the patient's heart failure scores, their quality of life, and interestingly also left atrial volume improved with this exercise program. And so finally, something that we can offer to patients with heart failure and preserved ejection fraction that may make them feel better. So for this week's Cardiology Countdown, I'm Chris Cannon.